Back now on TriadToday, and it's time to talk about histotechnology. And if you're as confused as I am, we're going to clear that up with a very special guest right now because it's an important topic that can translate to some great jobs. Let's meet her right now. Dr. Bridget Ledford Waters is Department Head of Medical Laboratory Technology and Histotechnology at Alamance Community College. Welcome.
Thank you so much for having me, Jim.
By way of Indiana, we're glad that you're now North Carolinian. Now, we've had folks from Alamance Community College come on plenty of times before. We've talked about all sorts of things like the biology, the biotechnology center of excellence, that kind of thing. But my notes from Ed Williams said, ask her about histotechnology. What in the world is that?
Well, histotechnology is an area of medicine where our technicians will take tissue samples from biopsies that doctors collect, and they will treat those tissue samples, then stain them with different stains and colorings so that the physician can then go back and look at those to see whether or not the cells in those tissues are normal.
Wow, that's very highly professional job that you have to do. I mean, you have to really have a lot of training for that. And I assume that's why you're here, because you're going to talk about how we're doing that at Alamance Community College. Before we talk about that, though, is there a high demand for someone in that field now?
Absolutely. We have a long-standing program already in medical laboratory technology, and the graduates from that program, 100% are employed in the field within 6 months of graduation.
Good grief.
Yeah, many of them have more than one job offer before they graduate.
That is fantastic. That's a great success story for Alamance Community College, and it sounds like we're doing a commercial, and I'm not, but I mean, it is what it is. It's a great success story. Now, I understand, of course, we all know that you have the world's largest diagnostic company virtually in your backyard. How does having Labcorp being in Burlington affect your program?
Labcorp was one of the major driving factors in our decision to start a program in histotechnology. They already do employ many of our medical laboratory graduates, but they have an immense need for histotechnologists specifically.
At Labcorp.
At Labcorp. And so now that we've started that program, we expect that many of our graduates will find lucrative careers there.
Well, what kind of folks gravitate to work in the medical lab field? I mean, probably not somebody 100 years old like me, but what kind of folks gravitate to it?
Normally, our students gravitate towards science and medicine. Many of them have worked in other areas of the medical field, such as nursing, or they work as phlebotomists drawing blood samples, but they want to kind of take a step behind closed doors and work behind the scenes to help diagnose and help improve the lives of the patients that are seen every day.
Now, I don't want to sound greedy or anything, but if I'm interested in this, what if I ask you, gee, are there good salaries involved in this kind of career?
Absolutely, Jim. Entry-level salaries for histotechnology can range anywhere from $35,000 to $45,000 a year and upward.
That's great. Now, is it too late to enroll in your program for 2020?
It is not too late. We enroll for our program in every semester, and right now we are enrolling for spring semester at ACC.
I want to put up some information on screen. So it's a general website for the college, alamancecc.edu. For our radio listening audience, I'll say it again, alamancecc.edu. We'll get you all sorts of information. We have about a minute left, and I'm going to put you on the spot. We didn't rehearse this or anything, but what made you want to go into this field, and why did you want to do it?
Well, I was 12 years old, and I entered a science fair, and I decided I was going to do my project on the HIV virus. It was new to the world of medicine way back then.
Right.
And once I started looking into that, I realized, well, there are doctors, but there are these other people that are actually taking patient samples, and they know before the doctor knows if a person has an infection.
What the results are.
Yeah.
Well, bless your heart. I just think that's great. That's a great motivation. Well, will you come back sometime and visit with us?
Absolutely. Thank you, Jim.
All right. Thanks, Bridget.